Hello class, my name is Liz Tapia and I'm going to be discussing the reasons for choosing this service area, starting with the pros to becoming a public health nurse. The first one being the people. PHNs always work with others, their clients, team members, interprofessional colleagues, and various community members in striving to meet their goals for improving public health. Public health nurses have a unique opportunity to develop caring relationships with individuals, families, and groups such as community systems. Many PHNs develop and maintain caring relationships with their clients over weeks, months, and sometimes even years. As a public health nurse, you'll get to meet and work with a wide range of people who have diverse and unique stories. If you want a broader, fuller nursing experience, public health nursing can be a great profession. You'll also have the opportunity to make a difference in an entire community. Studies show that per capita rate of primary care physicians in lower rural areas of the country with 40 physicians per 100,000 rural Americans compared to 53.3 physicians available in urban and suburban areas. So rural residents are more likely to suffer from chronic health conditions such as diabetes, cancer, heart disease, depression, drug abuse, and viral outbreaks. Also, these communities need education on social and lifestyle changes that can influence drug abuse, child neglect, and self-sufficiency challenges. The second pro is the opportunity to create a positive inroads within local communities. PHNs have the opportunity to work with other community members to create sustainable community partnership to work to achieve health equity through social and political advocacy. PHNs are uniquely suited to participate in political processes since they are confronted with daily social determinants of health that often negatively affect their clients' health. They can participate in policy development and enforcement process because the knowledge of healthcare and health needs of the community make PHNs an expert in the eyes of elected officials. PHNs create change by providing interventions that enrich healthcare abilities of the agency and build organizational capacity. PHNs add community assets and strengthen its ability to manage their own healthcare needs by empowering vulnerable populations and their communities. You can be a part of a change of the movement towards health education and prevention, which, is very fulfilling. When the Zika virus outbreak made national news, most people figured it was an issue limited to other countries, but in fact there was 36,986 symptomatic Zika virus disease cases reported in the U.S. territories. While doctors find solutions to control further outbreaks of Zika and other global threats to our health, it's up to PHNs and the public sector to build awareness of the risks to educate communities on preventative measures. So that's just an example of how PHNs work towards educating health and prevention. Another benefit is the variety of settings to work in. You can find PHNs working in all levels of government, in suburban and rural settings, and in a variety of community agencies and organizations. Federal, state, and local governments all provide essential resources for contributing to the public's health. Public health nurses are often employed by community health centers, community clinics, schools, churches, nonprofit organizations, public health departments, and other government agencies. The last pro we have is the creativity. When you're trying to improve the health of a community, there's a lot of room for new ideas and initiatives. Public health nurses often have the opportunity to come up with new methods of communication, new messages, and new programs designed to improve the community's health. This makes community health nursing a great fit for you if you're creative and enjoy developing new solutions.